ahead and introduce to you Eddy Rospide, and I'll transition this over to him. Eddy is the EMR HIE Director at Winchester Highland Management, where he has tirelessly worked to help build the Winchester Highland Management and elinc connections to the highway. Prior to joining Winchester, Eddy served as a Director of Information Systems, Data Integration Services at Albany Medical Center, and prior to that, he was a Director of Professional Services at WellLogic. Of note, Winchester Highland Management is one of our 32 highway implementation grantees, and with that, I'll go ahead and allow Eddy to share his presentation with you.
Our HIE basically was formed between Winchester Hospital and the IPA. The IPA here in the community, it's an independent practice association, is made up of almost 400 physicians across the community. If you want to learn a little bit more about us, you can go to that link. This is our test website that we just published this past week. And what elinc stands for is to electronically leveraging information, improving care, networking providers, and communicating with each other. We see this HIE as a vehicle for providers to message each other, share and exchange information in a secure, safe, and non-competitive manner. And that's really key here, non-competitive manner, okay? The same folks that implemented the HM-supported EMRs, typically are working with our participants. But, this is, I want to actually explain, when a group joins elinc, even though we are a business venture between both the Winchester Hospital and the IPA, the specific members of those organizations actually have to join the HIE separately, okay? They have to sign participation agreements. We have to work with them. We typically, our team is the same team that actually implemented the EMRs, that helped them with meaningful use attestation. So when one of those groups actually join our team, we make available to them secure, direct messaging accounts that they can use to communicate with each other. So our first preference is that the physicians or the clinicians communicate directly inside their EMR. If they cannot obtain a secure direct address from their EMR vendor, we can allocate them one, or we can forward them to the Mass State Highway. We also provide hospital admission and discharge notifications for primary care providers. So right now we have it available for our PCPs. Right now we have it set up for the ACO, the Winchester ACO, where if one of their patients on the list of ACO patients arrive at the hospital at DED, or they get discharged from DED or get admitted to the hospital, then the care managers at the ACO would get a notification, okay? And our physicians, we haven't published this well enough. Our physicians can actually register for this and provide a list of patients. So when I start talking about the use cases that we're working with Salter, we'll talk about how the next step that we're taking with this. Clinicians can access their clinical information, directly in their EMR. So when we talk about our elinc HIE, what we're trying to do is make sure that clinicians are not going to log into a portal. We want to make it so that we integrate directly inside the EMR, which ends up giving us close to 100% adoption, because if it's integrated in their EMR, they're less likely to want to go somewhere else. They can actually access the information and make it an inherent part of their workflow. We also deliver results from Winchester hospitals, like lab results, radiology reports, as well as departmental reports from Winchester Hospital to any other IPA physicians directly in the EMR via HL7 interfaces. Later on, I'll talk more about some of the business intelligence services that we want to provide for the network for provider quality performance reporting to some of the networks or insurance companies that they have contracts with. Okay. So let me try to explain, trying to describe what our ecosystem looks like. I did say we have about 400 physicians, Winchester Hospital. Currently, out of those 400 physicians, there are 208 that are eligible physicians that have EMRs that have it tested for MeFuse Stage 1. And we're diligently working with those providers to get them ready for Stage 2. We have 81 interfaces between Winchester Hospital and those physician practices. And of those 400 physicians, some of which are required to actually have EMRs, we have 23 different EMRs in the community, okay? But we only support 11. So there are some practices, for example, an IVF, an in vitro fertilization site that may be using an EMR that is not MeFuse compliant because it's typically a cash-based business, and they don't typically implement MeFuse type of EMRs. So you're going to have a lot of systems out there that are not MeFuse compliant, okay? And of those 23, there are 11 that are currently supported, and they're listed right there: elinc, Athena, Allscripts, Nextech, GE Centricity, Origin, Practice Partners, MD Intellisys, Vitera, NextGen, and Amazing Charts. 23 practices or 27 physicians currently are still on paper. So we are at like 87% EMR adoption, and we hope to complete these hopefully by the end of the year. But those are usually the holdouts. Those are the folks who are waiting until hell freezes over before they implement an EMR. So a lot of them are waiting to retire. Some may have gotten waivers, so they don't have to implement an EMR in the network until next year. So what are some of the use cases that we support? Originally, Winchester Highland Management had applied for, and thanks to the MeHI folks and the Mass State Highway, we received a grant that would allow Excel Orthopedics to send patient information to Winchester Home Care as part of the program for the joint surgery program over at Winchester Hospital. So what this program is where Excel is a big orthopedic practice. They send patients to Winchester Home Care who are going to have surgery at Winchester Home Care. And the key here is they're having joint and knee surgeries or hip surgeries that they would be discharged home as opposed to another healthcare organization. So thereby reducing costs, because with the patients going home, it reduces costs. So that's a really good use case. And then also Excel Orthopedics is using that same grant. Excel Orthopedics is actually communicating with the surgical pre-admission and testing folks, making sure that the surgical packages are ready to go. So that grant has been a godsend for us, where we've been able to actually deploy our HIS and then connected it to the Mass State Highway. Winchester Hospital is connected. The Winchester Home Care folks and the folks at the surgical pre-admission and testing are connected to the Mass State Highway. And the folks at Excel Orthopedics are on the elinc Health Information Service Provider accounts. So they connect using elinc Direct. They send messages directly to Winchester Home Care or Winchester Surgical Pre-Admission Testing to coordinate the care of that patient for that surgery, so that they can prevent the patient from being readmitted, and also of being admitted to another healthcare organization, and they want them to go home. Okay. So some of the upcoming activities that we're working on. Well, actually, before I move on, I want to actually we also work with Salter, another organization that's actually joined the HIE. That's a non-Winchester organization. They've joined our HIE, and they received a grant from the Mass State Highway. Working with us is to do the same exact thing. Salter is part of elinc. They are communicating with the Winchester ED and the Medical Records Department. So when they send a patient to Winchester Hospital, to the ED, they electronically will send that information over to Winchester Hospital, and then Winchester Hospital would then, when that patient is getting discharged, they're going to send a CCD back to Salter Healthcare, okay, thereby coordinating care transition between the two organizations, okay. So some of the key activities that we're working on this year is really we want to deploy secure messaging across the community. we want to continue working with our physicians to attest for MeFU Stage 2. We want to deploy the clinical repository, which is what we call elinc clinical, to the community. So right now we're going to pilot this with 2 ECW practices by the end of the month, and we're also integrating Athena. So most of our practices are on Athena and ECW, although we have that list of 11 supported vendors. The majority of our EMRs are on ECW and Athena, and we are trying to build IHE type interfaces with those EMRs. So our solution for our clinical repository is the ECW EEHX solution. And if you really look at its features and capabilities, Meaningful Use has been really, really good to this platform. With the Stage 2 CCDs, what we're trying to do is, with the Stage 2, what we're trying to do is get CCDs from EMRs that are Meaningful Use Stage 2 compliant. So the software does support the C32 CCD integration. Documents can be uploaded directly from the ECW practices, and consent can flow directly from the ADT, directly from the integrated EMRs. So typically what we try to do with the EMRs is we have them capture the patient consent on the EMR, and then an ADT message along with the CCD at the end of the day, at the end of the encounter, would need to come to the HIE. So the model that we are implementing from an HIE standpoint is a centralized model where data from the EMRs will be uploaded to the HIE for access by folks within the community for patients who have given consent within the community. Now, our consent model is one that is community-wide, so the patient only needs to consent in one location, and then when that patient is being seen at another location, if they have an interface to the HIE, that physician will have access to that patient's record. Okay. Some other work that we have that we're working on in progress with our platform is really we want to make sure that physicians who don't have the native interface with the HIE can actually download an encrypted CCD. Because one of the key things that we want to make sure from a privacy security standpoint, if you download a CCD on a PC, that it's got a password associated with it, so for privacy and security. The patient consent capture, by participant staff, in cases where no ADT interface with consent exists between the participant, with the participant EMR and the HIE. Okay, so if there's no native interface where they're going to give us an ADT that says the patient gave consent, well, somebody has to log on to the HIE portal and say this patient gave consent, right? And then the other items is really more on monitoring performance and then workflow, and really the proper education of participants. So we have a lot of work to do. What we're trying to do, we have a very small team. What we're trying to do is roll out this solution across the community. We're ready to go. And our first 2 big pilots are going to be with ECW and Athena, and then after that we're going to roll it out to those. Once we test the interface, we're going to roll it out practice by practice, at least for those 2 EMRs, and then continue working with the other EMR vendors to pilot and then deploy within the same environment. So what I thought I'd do is actually give you guys, this diagram is actually a year old. It will be interesting to see whether it's consistent with some of the stuff that we've done. But basically, if you look at the diagram that we provided with our ecosystem, Winchester Hospital runs Meditech. And then here you have the elinc platform, which comprises of EHX, the elinc HIS, which is supported by Secure Exchange Solutions, and then Provider Exchange, as well as Summit for our integration engine. So what we're trying, and then on this side, we have a bunch of EMRs that we support. Right now, this list may be incomplete, but I think what's missing on here is MD Intellisys. But basically, most of the IPA practices on these EMRs, and then most of the IPA practices have their own patient portal. So what we do right now is we deliver results from Winchester Hospital. So anything that connects to this box in the middle is the elinc HIE. So we deliver results to those practices. And then at the end of the day, once a practice finishes seeing a patient, if they are a member of the HIE, clinical encounter information will flow from that EMR to EHX. And then one of the other projects that we are working with Winchester Hospital this summer is to actually take ambulatory orders and then send them to Winchester Hospital to help improve the workflow so that the order IDs now are closing the loop and making sure that the results that were the tests that were ordered from Winchester Hospital are actually matching the order IDs. Then obviously we have the physicians doing secure messaging. Winchester Hospital is connected to the Mass State Highway, and the folks on the other side with the IPA practices, they're either connected to the EMR or the elinc HIS, okay? And then there'll be most of them, most of these EMRs here can actually connect. So let's go down the list, for example. ECW, we've already tested with eClinicalWorks. So elinc can send to ECW. We've tested sending production information from Winchester Hospital all the way to Athena. NextTech has the same HIS as we do, so that's a non-issue. Practice Partners uses Relay Health, which is part of the Direct Trust, and the company that provides the services is part of the Direct Trust. GE Centricity, they use Cryptic, which is now related to SureScripts, and they're part of the Direct Trust. This company hasn't done its work yet. Allscripts is actually using MedAllies. MD Intellisys is actually using Secure Exchange Solutions. So those organizations, except for those EMR vendors, except for Origin and Vitera, they're actually using technologies that we either have connected to or they're part of the Direct Trust, which the company that we work with is connected to. So most of our providers here will be able to communicate with Winchester Hospital and with each other. So our goal is to allow them to actually to be able to communicate with each other and help improve the coordination of care. And then Winchester Hospital also is attesting for meaningful use, meaning that they need to send discharge CCDs out to the providers in the community as well, and that's on the way. And then eventually what we'd like to do is when the RLS query response piece with the Mass State Highway comes about, we want to act as the source for our participants for the Mass State Highway, okay? The third piece to be determined is the connection with skilled nursing facilities, NEQA, which is a contracting company that is associated with the IPA. Winchester Home Care, which is actually a part of the grant, has already been done. So thanks, MeHI, for that. And then we want to connect both to Tufts Medical Center as well as Leahy Health. So with that, I think one of the things I want to make sure that folks understand, with our longitudinal patient record, providers have three different ways of getting into it. And I like the first one. No, actually, I like the third one the best, okay? They basically access it to their EMR. There's no logging into anything. It's a direct interface right into their EMR. And the first two, those are for practices like, for example, Practice Partners, Origin, and Vitera, where the providers are not going to have a native interface that's IHE compliant into their EMR. So in that situation, then the provider would have to log in or use a magic button to get access to the HIE data from the community.